Namaskar students of Msc N&D third sem. So today's session topic of your course nutrition management is the nutritional care in strokes. Okay, so strokes first we will talk about what are strokes. So strokes you may have heard about like hemorrhages strokes. So these are basically happen when your blood from the ruptured vessel damage your brain tissues. Okay, हेमोरेजिक स्ट्रोक्स तो आपके ऐसे होते हैं कि जैसे आपका जो ब्रेन टिश्यू आपके डैमेज हो जाता है, ठीक है। स्ट्रोक मतलब एक टाइप का, मतलब जब आपको नमनेस हो जाती है, जब फेंट हो जाते हो, ठीक है, तो दैट इज नोन एज स्ट्रोक्स, ठीक है। अब कभी कभी अपने से यू मे हैव हर्ड अबाउट लाइक ब्रेन स्ट्रोक्स और हेमोरेजिक स्ट्रोक्स। तो दीज आर मच मोर कॉम्प्लिकेटेड फॉर्म. It usually resolve completely within 30 to 60 minutes, although symptoms may last for several hours. In contrast to strokes, mainly the neurological and cardiovascular evaluation of strokes is at risk. ठीक है, मतलब आपको न्यूरोलॉजिकल स्ट्रोक पड़ते हैं या फिर कार्डियोलॉजिकल, जैसे दिल में किसी दौरा पड़ना होता है, ठीक है, जैसे ऐसा कुछ होता है, ठीक है, या आपको मतलब ब्रेन ब्रेन में स्ट्रोक्स पड़ते हैं, तो that is basically from your strokes. So the symptoms of the strokes may be of the following: that when the sudden changes occur, when the symptoms of strokes may can be happen. The first one is your numbness. So numbness is basically paresthesia, when your half of a body got numb because of strokes. The second is your weakness. Okay, so weakness of face, arms, legs, or usually one sided of the body when you got stroke or paralysis. The second is your confusion, difficulty in speaking, understanding, visual disturbances, partial or complete vision loss, dizziness, severe headache. Okay, so these all are the symptoms of your strokes. Now, what are the risk factors? So, risk factor, there are various kinds of risk factor. The main or the main risk factor may be of your age. Okay, risk of the strokes double at every 10 years beyond the age of 55. It means कि अगर अगर 50 क्रॉस हो जाता है, जैसे ओल्ड एज में हम जाते हैं, तो आफ्टर 50 आपके क्या होते हैं, हर 10 साल बाद आपके जो स्ट्रोक के चांसेस होते हैं वो डबल हो जाते हैं, ठीक है। देन द जेंडर, जो जेंडर, वुमेन हैव बेसिकली हायर इंसिडेंस ऑफ स्ट्रोक्स एज कम्पेयर टू मेन, बिकॉज लाइक वुमेन का जो अपना जो फिजियोलॉजी है, जो फीमेल फिजियोलॉजी है, दैट इज डिफरेंट फ्रॉम द मैन. Okay, so they have higher incidence of stroke because of their changes of their hormones, changes of their physical attributes also. The third is your hypertension. Hypertension is a it's a modifiable risk factor, specifically for the hemorrhagic strokes. Okay, because hypertension क्या करता है? Hypertension एकदम से आपका risk increase कर देता है for the strokes of the patient. Because blood circulation बढ़ता है, और जैसे ही फिर आपके brain में ज़्यादा तेजी से अगर blood flow होना start हो, अगर hypertension में या any stress condition, so it can lead to stroke. Smoking can also increase the chances of strokes. Other than this, the overweight, diabetes, dyslipidemia, poor nutrition. So these all are the various risk factors that contribute to the strokes. Now, what are the nutritional consideration that we can take during the strokes? The first is a healthy dietary pattern. Healthy dietary pattern, basically when you take a energy dense food, high in saturated fat, okay, fried, like when you avoid fried food or like high glycemic food, so it can reduces the chance of your strokes. Okay, and like we have to very much conscious about the diet. We have to take a whole whole grains or your vegetables or your cereals, and like as you have studied in your food pyramid. Okay, so food pyramid, what they say, like the maximum energy should come from the cereals and pulses. Okay, so as we go on the pyramid, at the tip, the amount of the content, the amount of the nutrient is decreasing. Okay, so this is the pattern that you should involve in your diet also. Likewise, balanced diet is very essential to avoid the chances of strokes. Taking plenty of fruits, vegetables can make your condition, or can make you decrease at the risk of strokes. Other than this, the dietary fiber should be included in diet in much more amount, and the diet should be low in refined carbohydrate, consuming less sodium and more potassium, because sodium, like sodium uh, incorporation, sodium can lead to a various types of hypertension problem, and also can result in water retention. Then the maintenance of healthy body weight. Okay, this is very much important because the risk of stroke increases with the degree of overweight, like how much you are obese or how much you are overweight or overgain. So that can like brings the lot of risk of strokes also. So this is all with your nutrition care of strokes. In case of any doubt, we will continue your live session. And till then, thank you. In case of any doubt, you may ask in the comment box.